It's been very, very popular with doctors and nurses, particularly in some parts of Scotland where we started it earlier, in Lothian and Lanarkshire, for example. In some practices in Lothian, almost 1,000 patients are being managed in this way. And as you can imagine, there are very few doctors and nurses who would continue to use a system like this if it was creating work for them. They're very enthusiastic about it. Patients love it. All the feedback we get back from patients is that they find it helpful. We have some very elderly patients using it. Some use their relatives and friends to help them with these devices, but most of them can manage it perfectly well. The oldest person we had using this in Lothian was 95. We now have a national remote monitoring solution, which is an excellent solution for this because it provides the patient with a variety of ways of sending in their data. They can use an app, text, they can go online on their computer, or they can use touch-tone telephone with pre-recorded messages. So it's open to just about every type of patient. It's highly configurable. It links to Docman and also has the potential to link to Sky Store so that colleagues in hospital are able to see reports as well.
Hi, my name is Susan Shaw and I'm one of the GP partners at Kenmure Medical Practice. Last year we were asked to participate in the pilot for home BP monitoring, and the practice has overall been pleased with the results. By far the biggest benefit to the practice was the supply of 30 new BP monitors, and this enabled us to eliminate our waiting time for home blood pressure monitoring, which was previously limited by the small number of BP cuffs the practice owned. The patients have generally given us positive feedback and are quite happy with the service. We've also seen an improvement in the safety of the system, as the electronic calculation of average BPs has eliminated any human error in this calculation.
Hello, my name's Jennifer and I'm a practice manager. I'm based in the group practice in Stornoway in the Western Isles, and the health board is NHS Western Isles. We have two practices, one in Stornoway, which is an urban area, and one in Ness, so that's more remote and rural. So we have a wide geographical spread of patients, and it's a remote and rural area. So the reasons that we want to use digital BP monitoring, it's to save patients long trips to appointments primarily, and to make it more convenient for them as well. So that's the two main reasons for patients. For the practice, we're keen to use Docman rather than pieces of paper, which is what we have at the moment. So patients are doing their BP monitoring at home and we end up with lots of bits of paper, which then our admin have to scan into Docman and let the nurse know it's there. So we hope this system will be a lot simpler and that there'll be a schedule. So at the moment it's kind of up to the patients to decide when to do their BP and when to send it in. But we hope by using this system it'll be more organised and the nurse and the patient can work together. So the nurses are really keen to look into shared care and for the patients to have more ownership on monitoring their own health and empowering them in that way. So I think that's all the main reasons, but yeah, we're keen to start using it in our practice.
We've been using Inhealthcare now for approximately 2 months. I find the system really easy to use. Find navigating around the system's quite simple. Features I enjoy about it is that it's average, your blood pressure is average by the time it comes back to us. Also, you can send ad hoc messages to patients. You can find your patients easily and check their blood pressure readings at any point in time through the process. And patient feedback seems to be really positive so far.